slipped into the country undetected.
Both the passenger on the Victorian plane and the New South Wales plane didn't develop symptoms till after they landed in Australia.
And the first Australian cases of coronavirus highlight the scale of the challenge facing health authorities.
Generally, border screenings through just symptoms like that doesn't pick people up.
We are now meeting every flight from China and providing the passengers with an information sheet, asking them to identify themselves.
In China, 50 million people are in lockdown. Chinese New Year events have been cancelled. Tourist attractions shut down.
In response to the prevention and control of the disease outbreak, Shanghai Disneyland are temporarily closed now.
Wuhan, the ground zero for the epidemic, is a ghost town. Authorities are shipping food and medical supplies into the quarantine zone, while 2 hospitals are being built in mere days, specifically to treat coronavirus patients. The official toll keeps climbing, with almost 2,000 confirmed cases and 56 deaths. And in a country where the government controls the news and social media is heavily censored, it's hard to know what's really going on. But these unverified reports and these videos paint a terrifying picture. Health workers at breaking point, panic in the streets, hospitals overflowing, and suggestions that the true scale of the crisis has been kept under wraps.
我目前还在武汉汉口这个疫区，现在已经有9万多人次。
Cases have now been confirmed in 13 countries, and the race to develop a vaccine is on, with Australian scientists at the forefront.
We were initially tasked by CEPI to develop a vaccine in 16 weeks, so we're already halfway through developing this pipeline and we're ready to respond to this particular pathogen.
But in the meantime, what can we do to protect ourselves from the contagion?
Well, Dr. Sanjaya Senanaika is an infectious diseases expert. Sanjaya, it's pretty easy to feel helpless here. What can people actually do?
Well, Peter, I think in Australia we've only got less than a handful of cases. So I think in Australia we can sit tight and let the health authorities identify and isolate suspected cases. So we shouldn't worry too much in Australia. Of course, in China, where the disease is so widespread, it's a completely different story, where people should be washing their hands after going out in public and wearing masks if they're going to public gatherings. And of course, the Chinese government has instituted a whole lot of extraordinary measures to limit travel and movement of people.
But, Doctor, we are seeing some pretty concerning stuff coming out of China through social media. Are you happy that the Chinese government is doing enough and that there is enough of a flow of information going on?
Lisa, yeah, we only know what we know, and I guess we don't know what we don't know, which sounds pretty obvious in some ways. But it seems like with this outbreak, the central Chinese government is being more forthcoming. And we have to compare this to the SARS outbreak back in 2003, where the Chinese government didn't share so well. So it's definitely better now. Where we have seen a lapse is probably with the Wuhan government locally, where the mayor himself in an interview has said that things could have been done better.
Sanjaya, we know that medical staff have been treating people who have contracted the virus. As a doctor, how scary is it to have to go into the front line and treat patients with something this dangerous?
Look, this is something that worries healthcare workers, and I keep talking about SARS because we're still trying to understand the transmission dynamics of this particular virus, but it seems to be very similar to SARS at this stage. And SARS accounted for a number of fatal casualties in healthcare workers in Hong Kong and Singapore, for instance. So it is something that worries us. But having said that, every time someone comes in with a communicable disease, we practice the same isolation measures and precautions, and that's what we should be doing all the time.
Doctor, you're an infectious diseases expert. Does that mean you get a little bit excited when something like this pops up?
Look, it's certainly something of interest, but I won't say I'm happy about it by any means. So it's something we have to be wary of and be ready to pounce on when they occur. So I'm happy I'm around for that.
Sanjay, we appreciate your time as always. Thank you.
Thank you.
I think the most worrying part about it is that in China, how much information do we really know for sure? It's hard enough to get facts out of our government, a democratic government, much less out of China. That's the real worry. Is it much worse than we think?
It's funny, for a country, we're pretty thingy about our borders, but we've still got
Pretty thingy about our borders. Yes, we are. I see the border force when I come in and I'm like, you guys are a bit thingy.
No, we're usually very protective of our borders. We've still got lots of flights coming in from China. Wuhan, not anymore. There were 3 flights a week. But there's a 14-day incubation period. So we still don't know what we don't know, to quote Sanjay.
Exactly right.